Welcome to Tetramed EX channel. Today we will learn about the Site Master File, Mandatory Regulatory Requirements, focusing on the MDR 2017 Compliance and Documentation Framework. The legal framework is specified under Appendix I of the 4th Schedule of Medical Device Rules, MDR 2017. Key components of the Site Master File include production operations, quality control systems, arrangements for materials, self-inspection, and complaints handling. Let's explore the key SMF components in detail. We cover production operations and flowcharts, quality control systems and biological controls, and arrangements for raw materials and finished goods, including vendor qualification and storage controls. The first section of the Site Master File addresses general information. This includes site details such as legal name and address, corporate links to other entities, licensed activities, and the scope of other non-medical device operations. A critical part of the general information is the documentation of licensed activities, detailing the license ID, device category, risk class, validity period, and the issuing authority for all manufactured medical devices. Section 2 focuses on personnel and organization structure. This section requires the organizational chart, documentation of key personnel, the training framework, and established health requirements for production staff. This diagram illustrates the hierarchical structure of the organization, detailing roles such as the managing director, quality assurance, regulatory affairs, production, and R&D, along with their respective qualifications and responsibilities. Documenting key personnel involves detailing their qualifications, job experiences, and legal responsibilities, ensuring all technical staff meet the necessary requirements for their roles. The training framework follows a continuous improvement loop, starting with identifying needs and designing the program, followed by instruction, log maintenance, verification of competence, and final assessment. Section 3 covers premises, facilities, and utilities. Key documentation includes layout plans, detailing movement paths, zoning and environment specifications, including cleanroom ISO classifications, HVAC system summaries, and critical utilities descriptions. The layout plan section features scaled schematics illustrating the flow of raw materials, personnel, and finished goods through the site, alongside documentation for zoning and critical utilities. Section 4 addresses equipment inventory and maintenance, including the equipment list and maintenance and calibration schedules. Critical validation records cover IQ, OQ, and PQ statuses, ensuring proper installation, operation, and performance. In production and process control, we outline device classes, ranging from Class A to D risk types. We also address validation status protocols, material segregation for rejected items, and process flowcharts from raw material handling to final boxing. Medical devices are categorized into 4 classes based on risk: Class A, low risk; Class B, low to moderate risk; Class C, moderate to high risk; and Class D, high risk/critical. Section 6 focuses on the quality management system, requiring evidence of regulatory compliance with MDR 2017 and ISO 13485. This section also covers SOP tiers for managing critical changes and the traceability logic for tracking products from components to buyers. The SOP tiers define the hierarchical and functional structure for quality management, including change control for modifications, OOS testing for analyzing out-of-specification results, and CAPA logging for implementing corrective and preventative actions. Section 7, Sanitation, Risk, and Vigilance is crucial. It details cleaning procedures with written specifications for production rooms and machines, risk management protocols based on ISO 14971, and market vigilance systems, including recall decision trees and adverse event alerts. Section 7.1 details cleaning and microbial tracking. It covers production room cleaning SOPs, process machine cleaning with CIP and SIP cycles, and microbial level tracking, including alert and action limits for CFU counts and corrective action plans for exceedances. Section 7.2 outlines the ISO 14971 risk management workflow. This total life cycle includes planning and defining the scope, risk estimation based on a heat map of severity and probability, risk control implementation, and overall residual risk review. The Market Vigilance Comprehensive Operational Flow starts with a product complaint. A recall decision tree determines if there is a significant health risk, leading to market recall activation and rapid adverse event alerts to the CDSCO portal, or local correction in CAPA if no risk is found. Thank you for watching this video on the Site Master File regulatory requirements. Stay updated on medical device regulations by following this channel. Feel free to reach out via email for any questions or to request a custom document checklist based on your device, risk class, and source.